Just I want to clarify that Mariela, she was supposed to be with me, but based on health problems, unfortunately, she cannot be here, but she's part of this presentation. And just to inform you about this particular and unexpected situation, it happens. So I want to acknowledge the UNESCO Chair of Global Health and Education for inviting us to participate in this edition of the Global Community Annual Meeting. So the topic to be addressed, as it has been previously mentioned, refers to the commercial determinants of child and adolescent health. So I want to highlight this as aspect that based on my background, I'm a pediatrician and public health practitioner. We are going to go through this approach, focusing on children since early stages of life. So there will be some aspects that were not, perhaps they are not well diffused in the literature, and there are many issues that are part of our reflection and our discussions. So we are going to approach three aspects in this workshop or in this presentation. First, the objectives. Second, the theoretical framework that we build especially for this presentation and to approach this complex issue. And finally, hands-on. So the idea is to respond to what do we do, what do we know, what do we do, and what can be done at the community level. So this last part will be part of the debate that you are all invited in terms of discussing many of the issues that will be presented in this session, and also to have your views, and also to try to, as Glenn has mentioned before, to co-create, to co-design, and to co-learn building this kind of complex approach. So I also want to declare that we don't have any conflicts of interest. So this declaration is not a minor issue, since it is closely linked to the meaning of this presentation, considering that many times health professionals, both individually and through their organizations, are exposed to the existing tensions between the interests of transnational corporations and the best interests of the child. So these are the objectives of this presentation. You can read on screen to analyze the conceptual basis of the commercial determinants of child and adolescent health, to recognize how harmful marketing and products potentially affect children's health, and to identify the first stages of life as a crucial period on which the modalities of induced food insecurity are generated. So let's start with the problem. In February 2020, the WHO UNICEF Lancet Commission on Children at the Center of the SDGs launched its report entitled "A Future for the World's Children with question mark." This landmark report repositions every aspect of child health through the lens of our changing planet and other existential threats to children, and calls for urgent action. So this report finds that children across the world face an uncertain future due to a rapidly changing climate, mass commercial marketing of harmful products like sugar, fast food, tobacco, and alcohol, polluted environments, poverty, pervasive inequalities, migration and conflict, and from the failure of all sectors to integrate children's rights into their policies. The Commission concluded that commercial marketing of products and services that are harmful for children are one of the most underappreciated risks to their health and well-being. The rise of social media platforms has amplified harmful commercial marketing, making it more widespread and complex. What do we know? So pervasive promotion of unhealthy food and beverages is implicated in the rapid rise in childhood obesity, with an 11-fold increase in obese children and adolescents from 1975 to 2016. The scientific evidence is clear. Industry self-regulation does not work. So our theoretical framework has 4 approaches. First, the commercial determinants of child and adolescent health. Second, the life course approach. Thirdly, the concept of early child insecurity, early food insecurity, And finally, the child rights-based approach. So the idea is to integrate these approaches in terms of trying to build an understanding of this really complex issue, considering the population that we are dealing with. We are talking about newborns, we are talking about infants, we are talking of children in the preschool age. So let's go about the first approach. This definition encompasses all commercial entities rather than just corporations because we recognize their diversity. Second, the definition on commercial determinants of child health attempts to convey its complexity, considering that goes beyond a simple focus on unhealthy commodities and profits as the sole driver, instead recognizing that the links between the commercial sector and health are varied, involving complex political, economic, and social systems. Third, the definition is deliberately neutral, aiming to recognize positive and negative contribution and the potential change. And fourth, the definition is focused on health, both human and planetary health, which are interlinked and codependent on equity as the primary outcome of concern. Equity is deliberately highlighted because the commercial sector plays an important role in driving social and health inequity, both within and between countries. There's no doubt that the worst pandemic that is affecting our planet is not the kind of epidemics or pandemics that we see in the newspaper. The worst pandemic is called inequity, injustice, social exclusion, and poverty. Much of the literature consider its effects on the adult population without mentioning the importance of commercial determinants of health during early stages of life. And from our perspective, commercial determinants of childhood health acquires relevance since during early stages of life, behaviors related to palatability, consumption patterns, addictive behaviors to food components are shaped. So just to clarify, we understand that commercial determinants of health are a subset of the social determinants of health, although this is a rather new dimension that has not been explored, at least in the infant arena. So the question is, what are commercial determinants of health? According to Ilona Kickbush, it refers to the strategies and approaches used by the private sector to promote products and choices that are detrimental to health, emphasizing that this definition conceptually links both macro level, as you can see in the slide, and micro level that involves individuals, consumer choices, and health behavior, emphasizing them as dynamic. But from our perspective, that involves children, we developed this approach where commercial determinants of child health, that is something that is under discussion and the research and the scientific community, we consider that the commercial determinants of child health are strategies and approaches used by the private sector to promote products and behaviors that are harmful to health, acting from early stages of life, affecting the conditions to design responsibly, violating the rights of children and affecting the health, development, and quality of life of present and future life. So this means that we introduce a strong rights perspective in the definition, considering that children at early stages of life, they cannot make their own decisions freely. They don't have the autonomy, and they depend on the adult's decision in terms of what they do related to the commercial determinants of health. So the question is also, how do commercial determinants affect child health? So in this sense, as you can see in this slide, they act through two mechanisms, through harmful marketing strategies or through the harmful product itself. There are different pathways of action of commercial determinants of health, as you can see, that are based in three aspects. The drivers that are represented by the rules of trade of marketing, and why not the power of the transnational marketing corporations. The channels that refer to the stages of the marketing chain. And finally, the outcomes, considering the involved levels of health impact from the macro level to the micro level, as I mentioned before. I'm not going to talk today about the harmful effect of each product that will demand, I would say, a special activity or a special course or congress devoted to analyze how harmful products are affecting the health and quality of life of people, particularly children. Let's go to the second aspect of our theoretical framework, that is represented by the concept of early food insecurity. As you might know, as has been mentioned in our previous excellent presentation by our colleague Starhan, food insecurity refers to the situation in which people do not have adequate access to sufficient, safe, and nutritious food to meet their dietary needs and lead active and healthy lives. But again, how can we approach this with the perspective of early childhood? So in this sense, we understand early food insecurity that refers to the situation in which children do not have the contextual conditions to promote, protect, and fulfill the right to an adequate access to nutritious food and feeding experiences, considering the best interest of the child. So again, here, the rights component refers to the importance of considering children as subjects of rights and the need to understand the contextual conditions and factors that influence their life and their present and future health. So let's share an example to clarify this question. When we talk about early food insecurity, we ask ourselves on what is the origin or source of these threats. Without any question, the greatest global threat to the right to adequate child nutrition is the industry of breast milk substitutes that is represented in this slide as a network with associations, common interest, power, growing capacities to generate profits, affecting, in our case, the health of children since birth. We don't know about these networks, and they exist, and they have power, sometimes much power than the countries themselves, but they are related, as you can see in this slide, in different ways, building alliances, and with the main goal of generating profit. That is the sense of their existence. This is an existential issue for the private sector. Of course, we are going to share these slides and you have a chance to analyze this information more deeply. And as an example, this threat on early child food insecurity is represented by, through the WHO report on marketing, the $55 billion formula milk industry that represents greater economic investment than many countries. The harmful marketing of BMS, I'm talking about breast milk substitutes, and its contribution to poor global rates of exclusive breastfeeding is well known. This marketing is directed at the general public, health workers, and mothers via media, or through donations of free and low-cost supplies of BMS via gifts to health workers and to mothers. This aggressive marketing is key to the capture of infant diets and thus determining early dietary preferences. The creation of hyper-palatable foods is informed by a deep understanding of evolutionary biology, when survival was improved by stocking up on fats, sugars, and salts. In the case of BMS, this aggressively market introduced sugar early, and in so doing create a captive dietary audience for life. Inappropriate use of breast milk substitutes is associated with lower intelligence, obesity, and increased risk of diabetes and other non-communicable diseases. Let's go to the third component of this framework that is related to life course approach and the lessons from the neuroscience. Because of our increasing understanding of the neuroplasticity of young brains, we know that the brain may be more susceptible to inducement and that connections made in early years may be most impactful. In the USA, for example, children and adolescents are responsible for approximately $200 billion for food and beverage companies, making them a strategic target. From a life course perspective, their brand awareness and loyalty make them more likely to purchase the same product into adulthood. If the habit is established early in life, creating consumers early constitute a stable click to return the renewable income for these companies. So in this article, we analyze different aspects related with the capture of child development knowledge by marketing companies. The magnitude of marketing targeting children is well described, as it is the long history of close alignment between children's marketing and developmental psychology. We have also known for a long time how the marketing industry divided children into discrete age, gender, ethnic, and product segments in order to facilitate tailored messages. The life course perspective incorporates pathways which are constructed by the choices and actions from individual life trajectories. In addition, we know that children's diet in the first 1,000 days is crucial in determining dietary preferences and eating habits across the life course. So, when developing marketing strategies, companies that manufacture potentially harmful products for children and adolescents know how to identify the target population. They know their psychological characteristics and the type of message to build to penetrate directly or through intermediaries, parents and caregivers. Companies have a greater resource skills than those of us who compete with them, such as policies, public health programs, community health workers, and other community stakeholders. In other words, they have the science. They know on how to intervene in order to reach their goal, and their goal is called profit. Profit in all policies. So we know also that NCDs, non-communicable diseases, are the first cause of mortality and disability globally. Childcare providers should know that although NCDs have their greatest expression in adulthood, their beginning goes back to childhood and even to the gestational period when the influences of the ecosystem are shaping our functioning structure from early stages of life. So let's keep in mind that the problem starts at the very beginning of life, at the early stages of life. So although we see the whole picture in adulthood, we need to move back to childhood in order to be more effective in our interventions. And then let's go to the final approach that is related to child rights. And there are many arguments and justifications on why children's rights should be considered into this process. Many times, health problems are the results of the violations of the rights of the child, and something that is not visualized or easily recognized. Particularly in our countries, I'm talking about Latin America, where we unfortunately learn as society the rights issues and human rights after their systematic violation because the dictatorships and military governments. So we are now starting to learn what means rights in terms of building democratic society. So in this sense, we understand that children should have the right, I mean, the right should be promoted and not violated. I will ask you to mute your mic because I listen some back noise, please. So just as a justification, talking about arguments and justifications on why we should consider child rights-based approach, we highlight some of the key messages that we developed to promote the global agenda for child health and well-being that is in a One Lancet publication. Just to highlight 4 issues, you can see that it's needed to provide secure and friendly spaces, to approach the social determinants, and to respond to marketing child health, including the relationship between public and private sector. These all statements or justifications involve the commercial determinants of child and adolescent health. So there are many justifications and arguments on why it's important to have a child rights-based approach. So therefore, non-communicable diseases cannot be addressed as an individual problem, but is a population problem, and in this sense, NCDs constitute a problem of public health and political responsibility. In other words, if our intention is to control or modify the course of the NCDs, we will have to consider contextual factors beyond the individual ones from the very beginning of life. So, based on what it has been exposed, we ask you the same question that we ask ourselves. Should children be subjects of rights or market commodities? Based on the arguments and justifications presented today, we have no doubt that there is only one option aimed to promoting the rights and dignity of children. Let's move to the final part of this presentation. It is time to begin with the last part of this activity aimed at answering the 3 questions about what do we know, what do we do, and what should be done to address the commercial determinants of child health, prevent early food insecurity, and in this context, to protect and to promote and to fulfill the rights of the child. During the COVID-19 pandemic, the unhealthy commodities industries increased their manufacturing and profit. Among the products that significantly increased their marketing were identified alcohol, breast milk substitutes, gambling activities, tobacco, ultra-processed food and drink products, including sugar beverages. let's give a rapid snapshot of the situation in our region, in Latin America. Mexico is among the countries with the highest consumption of sugary drinks in the world, approximately 163 liters per person per year. Beverages that contribute the highest energy intake in Mexican population are soft drinks and the combination with other products. More than half of the boys and girls between the ages of 6 months to 2 years consume sugary drinks in a high proportion. And likewise, 92% of school children consume sugary drinks. In Brazil, we see that the weight prevalence of food insecurity among households with children is almost 50%, with different degrees: mild, nearly 30, moderate, 14, and severe, nearly 6% of food insecurity. And in my country, in Argentina, has the unfortunate context represented by childhood poverty that affects more than 50% of the childhood population in my country. Only 20% of children consume the recommended amounts of fruits and vegetables. 35% of the caloric intake comes from ultra-processed foods, and the probability of malnutrition due to the excess overweight and obesity is almost 58% higher in adolescents that belong to population in poverty. Applying the regulatory frameworks for the promotion of the consumption of healthy meals at an early stage of age, from a life course perspective, the burden of disease associated with the consumption of breast milk substitutes, sugary drinks, and ultra-processed food could be significantly reduced in general. So the problem is how to strengthen and how to improve the regulatory capacities of the country. And this can be approached not only at the national level, it can be approached to the subnational level, and why not at the local and the municipal level. So it's a question and a concern that I share with you in how to act and how to intervene in this complex issue. So let's move to the second question. What do we do? So I will share some of the experience that we are developing in this field. Let's look to some ongoing initiatives. These, among others, focus on the generation of knowledge and its articulation with the process of policy making. We made these publications denouncing the conflicts of interest of scientific journals and the violation of children's rights in research sponsored by the food industry. As another example, this is another example of in our participation in a meeting at the United Nations Committee of the Rights of the Child, where we made a presentation of the commercial determinants of child health and their implication on children focused on a child rights perspective. So I must be honest with you. The impact of that meeting was mild, was poor, and it didn't reach our expectation. But since that meeting to 2020 till now, we can see that there is some change and there is a greater interest and awareness in the problem. But I must tell you that our first meeting in that opportunity was poor. Another thing that we do is advocacy activities that constitutes a fundamental pillar in the support of organizations that promote safe food, respecting the rights of the child and reducing the harmful effects of marketing of breast milk substitutes. These are examples of activities that we support and where we had active participation. Now, we in Argentina, we conform a network of 40 community civil organizations for the formulation of a law that regulates the marketing code of breast milk substitutes. And we consider that the regulatory capacities, as I have mentioned before, of the states should be enhanced and strengthened, particularly in the global south. That as you might know, our governments, they are really weak in terms of confronting the power of the transnational corporations. And finally, we have adapted and validated the International Code of Marketing of Breast Milk Substitutes, monitoring instruments by applying the net code tools developed by WHO and UNICEF at the municipal level. So in this study, we have detected violation practices on part of the companies that manufacture BMS, as well as other sectors, such as health organizations. And this last problem became a current topic of interest by WHO that we can discuss now in the discussion session if we have extra time. So if we have a few minutes left to share with you, I would like to spend this remaining time for discussion to get your views. And also, if you have criticism and you don't agree with my presentation or my comments or these conceptual issues, this is the moment to discuss, look in each other, our eyes, and also trying to be honest in terms of rethinking our positions as health workers, as citizens, as people that are really committed with health of the population.